Hello everyone, this is Farha Noor. In this video, we'll be discussing about coronavirus or COVID-19. Now, without wasting time, let's get started. In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Now, the first question arises, what is pneumonia? Pneumonia is an inflammatory condition of the lung, primarily affecting the small air sacs known as alveoli. Pneumonia fills the lungs alveoli with fluid or pus, hindering oxygenation. The alveolus on the left is normal, whereas the one on the right is full of fluid from pneumonia. When you have pneumonia, it's possible for your lungs to fill with fluid. If that happens, they won't be able to transfer enough oxygen to your blood or get rid of the carbon dioxide in your blood. It's a serious condition because your organs need oxygen to work. Pneumonia is usually caused by infection with viruses or bacteria and less commonly by other microorganisms. Viruses may reach the lung by a number of different routes. Respiratory syncytial virus is typically contracted when people touch contaminated objects and they touch their eyes or nose. Other viral infections occur when contaminated airborne droplets are inhaled through the nose or mouth. Once in the upper airways, the viruses may make their way into the lungs, where they invade the cells lining airways alveoli or lung parenchyma. The invasion of the lungs may lead to varying degrees of cell death. When the immune system responds to the infection, even more lung damage may occur, as well as damaging the lungs. Many viruses simultaneously affect other organs and thus disrupt other body functions. Now coming to the previous topic which we were discussed earlier. When we started this video, we discussed about the pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. In Wuhan Institute of Virology, investigation found that the disease was caused by newly discovered coronavirus, which disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the Director General of the World Health Organization declared the outbreak of COVID-19 to be a public health emergency of international concern and issue a set of temporary recommendations. Now coming to our main topic on coronavirus. So as we all know, we heard this name so many times. So we all need to know more about this deadly virus, or say coronavirus, or you can also call it COVID-19. So in this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease and what's now rapidly evolving and might change in the future. So in this video, we will discussing all about coronavirus in detail. Now coming to our first question. So what is a coronavirus? Coronavirus are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives the appearance of a crown. Crown involves is called corona, and the virus get their name coronavirus. So here we are talking about coronavirus. So let's summarize the coronavirus structure and the function of the structural proteins. Coronavirus is a single positive sense RNA virus. Mutation rates of RNA viruses are greater than DNA viruses, suggesting a more efficient adaptation process for survival. The genome codes for at least 4 main structural proteins. Number 1, nucleocapsid protein, which is bound to RNA genome to make up nucleocapsid. Number 2, spike proteins. Spike proteins critical for binding of host cell receptors to facilitate entry of host cell. Number 3, envelope protein, which interacts with membrane protein to form viral envelope. And the fourth one is a membrane protein. Membrane protein is a central organizer of coronavirus assembly and it determines shape of viral envelope. There are different types of coronaviruses that cause illness in humans and animals. In humans, coronaviruses can cause respiratory infections ranging to common cold to the more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China 2003, the Middle East respiratory syndrome coronavirus, that is MERS, that was first identified in Saudi Arabia in 2012, and the SARS-CoV-2, the name of the virus that caused COVID-19, that was first reported in December 2019. So where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between the humans and the animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. And the animals' reservoirs of the new coronavirus is now not yet. Now coming to our next question, how does COVID-19 spread? The COVID-19 is spread from persons to person through droplets. When an infected person releases these droplets through coughing, talking or sneezing, for example, when close to the another person. They can also spread when these infected droplets lay down on objects, when another person touches them and then touches their eyes, nose or mouth. Now moving on, what are the symptoms of COVID-19? The incubation period, which is the time taken from exposure to virus and development of symptoms, is on average 5 to 6 days but can range from 1 to 14 days. There can be a range of symptoms from very mild to severe illness. Some people may not develop symptoms. Common symptoms may include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Do you know why does COVID-19 affect taste and smell? Some people reported loss of their senses of taste and smell. Although the mechanisms are not fully understood, there is an emerging consensus that smell loss occurs when the coronavirus infects cells that support neurons in the nose. Here, one more question is also arising. Is skin rash a new COVID-19 symptom? A new study which has been submitted for peer review has found that 8.8% of people reporting a positive coronavirus swab test had experienced a skin rash as part of their symptoms. Here's what doctors have to say. Painful skin rashes are emerging as a possible COVID-19 symptom. Now coming to our next question, can COVID-19 cause severe disease? And the answer is yes. Once the virus is deeply embedded in the body, it begins to cause more severe disease. Like say, pneumonia is a severe lung infection. In some people, it can be fatal, especially among the elderly and those with respiratory disorders. COVID-19, the disease the novel coronavirus causes, can spread to the lungs, causing pneumonia. And in critically ill patients, multiple organs are often affected. And even more severe cases, infection can cause even death also. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems such as chronic respiratory disease, obesity, high blood pressure, diabetes, heart disease and cancer. But how can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as RT-PCR. This test identifies the virus based on its genetic fingerprint. There is also a blood test that can check for the antibody against the virus, which may show that the someone is infected in the past. So moving on, what is the treatment for COVID-19? For the people who develop much more serious symptoms and need to be hospitalized and the treatment is primarily focused on supportive care while their body fights infections and reduces patient symptoms. Patients who have trouble breathing may be given supplemental oxygen if the oxygen is over and insufficient to help the patients to breathe. Healthcare providers may choose to put patients on mechanical ventilations such as BiPAP. BiPAP pushes air into the lungs and helps the user to take a deeper inhale. And in some situations, they may need to interpret and oxygenation the patients through conventional ventilators. Here's exactly where we are with vaccines and treatments for COVID-19. Scientists around the world have developed treatment and vaccine for the new coronavirus disease known as COVID-19. Several companies are working on antiviral drugs, some of which are already in use against the illness to treat people who have COVID-19, like say Remdesivir. On October 2020, the Food and Drug Administration gave the go-ahead to Remdesivir, the first drug approved for the treatment of COVID-19. Remdesivir is an antiviral medication which disrupts the viruses to replicate and spread within the body. Remdesivir is recommended for patients who have been hospitalized and require oxygen but are not on mechanical ventilation. Now second one is dexamethasone. Dexamethasone is a corticosteroid, a drug that makes adjustment to healthy immune system regularity itself. It can be used in patients who need oxygen and can be used in patients on mechanical ventilations or not on mechanical ventilations. Vaccines typically require years of research and testing before reaching the clinic. But in 2020, scientists embarked on a race to produce safe and effective coronavirus vaccines in record time. Here's a quick look at some of the ongoing COVID-19 vaccine projects such as Covaxin. Covaxin is India's first indigenous COVID-19 vaccine by Bharat Biotech developed in collaboration with the ICMR. And the other approved vaccines are University of Oxford AstraZeneca vaccine, Pfizer vaccine, Johnson & Johnson vaccine, Sputnik V vaccine, etc. There have been a number of proposed treatments or solutions you might have heard in news too, such as the use of injecting the blood plasma of people who are recovered from COVID-19, also called convalescent plasma, into patients who are seriously ill with disease. Now coming to our next question. How can we prevent the spread of the coronavirus disease or say COVID-19? The following actions help to prevent the spread of COVID-19. These include covering your mouth and nose when coughing and sneezing with flex elbow or tissue and throw tissue into closed bin immediately after use. And wash your hands with soap and running water when hands are visibly dirty. If your hands are not visibly dirty, frequently clean them by using alcohol-based hand rub or soap and water. And also maintaining at least 1 meter distance from people. And proper use mask and personal protection equipment, especially in health settings. It is important to stay home if you're feeling unwell and to call a hotline or medical professional. But if you have a fever, cough or difficulty in breathing, seek medical care early and share your travel history or contact with someone with healthcare provider. And also avoid close contact with people who are sick. As we all know, COVID-19 cases are extremely high. So please avoid large events and gatherings when possible. However, attending events and gatherings increases your risk of getting and spreading COVID-19. So please stay home to protect yourself and others from COVID-19. Now moving on, that's a quick look at this emerging infectious disease. And we are still learning about this virus every day. So given that this outbreak is evolving rapidly, and what we are currently know about this virus may change. And in last, we would like to thank all the frontliners who can't stay at home and are working day and night during this pandemic. They are at work so that we can be safe at home. So please stay safe, stay strong and stay home. So that's all about coronavirus or say COVID-19. I hope you understand all about it. And if you like this video, hit the like button, share it with your friends and please subscribe our channel to get more videos like that. Thank you. Bye bye.